Now, if we talk about side effect of these medicines, now these calcium channel blockers which are dipin, they are the very strong vasodilators, and due to that reason, medicines can cause hypotension. Now, whenever the peripheral resistance is reduced as a result of vasodilation, the BP will fall, but as a result of that, the body will try to stimulate the heart. We call it reflex tachycardia. So medicines will reduce the peripheral resistance, so BP will fall, and as a result of that, patient will develop reflex tachycardia. Now, headache is the most common side effect of medicine because of cerebral vasodilation. The drugs takes entry in CNS. That's why nimodipine is drug of choice for subarachnoid hemorrhage. Apart from that, the medicines will dilate the arterioles in the lower limb, but veins are not dilated, so medicines will cause edema as a side effect. So that is all about this calcium channel blockers and all about the 13 group of medicines. So 13 group of medicines we have discussed, which are known as antihypertensives. So 3 diuretics we have discussed, 3 group of medicines we have discussed under ANS, 3 group of medicines we have discussed under RAS blocker, renin inhibitor, ACE inhibitor, ARB, and 4 group of medicines we have covered under vasodilator. So total 13 group of medicines we have covered, that is known as antihypertensive drugs, right? So this topic is important and we have discussed this topic in detail, as well as this topic is easy. Now, what are the guidelines? How to treat this hypertension? So whenever patient requires maintenance treatment of hypertension, patient age is less than 55 years, you start preferably your treatment with ACE inhibitor. But if patient cannot tolerate this medicine due to cough, we discussed that cough is a side effect of ACE inhibitor due to bradykinin accumulation. So ACE inhibitor cannot be tolerated, then you switch to ARB. Otherwise, ACE inhibitors are always preferred as a first drug. Now, after starting ACE inhibitor, if the patient BP is not controlled, so NC means not controlled, the next step you have to increase the dose. The same thing applies to patients who are more than 55 years. Start with calcium channel blockers, give any dipin like amlodipine can be used. Now, if the patient BP is not controlled, you have to increase the dose. Now, even after increasing the dose on the both sides, the BP is not controlled, then the next step you have to do is you have to combine these two drugs. You have to give 2 salts together, one ACE inhibitor, one calcium channel blocker. Now, even after that the BP is not controlled, now you have to add the third medicine, that is diuretic, and mostly we prefer to add thiazide diuretic. And which thiazide diuretics are best? One is chlorthalidone, the second is indapamide. Now, even after that the BP is not controlled, you label this patient as a case of resistant hypertension, and then you have to add the fourth medicine over here, that is ARA. So ARA is the fourth medicine that you will add as a fourth medicine in cases of resistant hypertension. Now, apart from the drugs that is given for PIH, so which medicines are safe to use in patients of PIH? That labetalol. Labetalol is drug of choice, it's safe to use. Number 2 is alpha methyl dopa. So alpha methyl dopa is also safe to use. Third is hydralazine. Hydralazine, which is a potassium channel blocker, is also safe to use. So most of the time you get questions from these 3 drugs, but sometimes they can switch to other drugs also. For example, one drug is clonidine. Next is your nifedipine. If you remember, nifedipine is given for preterm labor, so it is safe to use in pregnant female. And the last one is prazosin, which you can also try. So these are the 3 medicines which are less commonly asked in your exam. So concentrate on first 3. The other 3 medicines, if you can remember, it's good for you. So these are the drugs which are given for PIH. All other medicines are unsafe. That is all about this topic, hypertension. So next is angina. Medicines which are given for the treatment of angina. So the drugs are nitrates. So nitrates are considered as drug of choice for acute attack of angina. So nitrates are considered as drug of choice for acute attack of angina. Second is beta blockers. So generation 2 and 3 beta blockers. Generation 2 and 3 beta blockers we use for cardiovascular system. Generation 1 medicines given for non-cardiovascular indication. Generation 2 and 3 medicine given for cardiovascular indication. Now they are the drug of choice for maintenance treatment of classical angina. So beta blockers are drug of choice for maintenance treatment of classical angina. And calcium channel blockers. Calcium channel blockers, that is dipin, they are the drug of choice for maintenance treatment of vasospastic angina. So dipins are drug of choice for maintenance treatment of vasospastic angina. And beta blockers, are drug of choice for maintenance treatment of classical angina. But nitrates are drug of choice for acute attack of angina. Whether it's classical or vasospastic does not matter. Nitrates are the best medicines for acute attack. Now, apart from that, we have discussed some medicines like nicorandil. Now, if we talk about nicorandil, here the CO word is given. So, CO word means it's a channel opener. So, this medicine is a channel opener, and this medicine is a opener of potassium channel. So, nicorandil is a drug which is a channel opener, potassium channel opener. The drug is nicorandil. So, it's a DIL. DIL means heart. So, medicine is given for cardiac problem. This medicine is given for cardiac problem, that is angina, and it's a channel opener, potassium channel opener, given for the treatment of angina. Right? Next is Fasudil, and in our class we made the mnemonic of Fasudil. That Fasu means in Hindi if we called Fasudil कि दिल जो है फंसा हुआ है. So दिल is for heart and Fasu is फंसा हुआ है. So दिल जो है फंसा हुआ है and जो दिल है वो रो रहा है. So in Hindi we made this mnemonic, and if you don't understand Hindi then this mnemonic is not for you. So Fasudil means the दिल है जो फंसा हुआ है और दिल जो है वो रो रहा है. So Rho kinase inhibitor. Fasudil is a drug which is a Rho kinase inhibitor. It's a Rho kinase inhibitor and used for angina. One more drug is ivabradine. So drug name is ivabradine. Now ivabradine is a drug that we made a mnemonic, that medicine is having the word bread. So medicine is having the word brady. So brady stands for bradycardia. So this drug can cause bradycardia, and I stands for funny channel, IF. So it's a blocker of funny current. Ivabradine is blocker of funny current, and by blocking the funny current, IF current, funny current, this medicine will cause bradycardia and reduces the load on the heart, and we use this medicine for the treatment of angina. Now, out of all these drugs, nitrates we discussed in detail during our lecture. So we discussed that for the treatment of acute attack of angina. For the treatment of acute attack of angina, nitroglycerin is a drug of choice, and we use this medicine by sublingual route. So sublingual route is a better route, even better than the IV route. One more drug was amyl nitrite. Now we discussed that amyl nitrite is the shortest acting nitrate. This medicine is a shortest acting nitrate, and people take this medicine by inhalational route for purpose of erection. So this medicine is misused as a sexual pleasure drug. So amyl nitrite, which is the shortest acting medicine taken by inhalational route, side effect is erection. People misuse the medicine for sexual pleasure. One more drug is isosorbide mononitrite. Now isosorbide mononitrite is a drug. It has two MCQs. The first MCQ, it's the longest acting nitrate. Isosorbide mononitrite is the longest acting nitrate because it has no first pass metabolism. So please remember, all nitrates have high first pass metabolism. All nitrates have high first pass metabolism, but there is only one nitrate which does not have high first pass metabolism, that is isosorbide mononitrite. So IMN full form is isosorbide mononitrate, which does not have high first pass metabolism. That is why it is the longest acting drug, and it is always given by oral route. First pass metabolism is a problem of only oral route. So if a drug does not have first pass metabolism, that drug is always given by oral route only, because first pass metabolism occurs only with oral route. Now what are the side effects of nitrates? Please remember, the nitrates are the drugs which can cause hypotension because of vasodilation. So medicine can cause hypotension, medicine can cause reflex tachycardia, same as dipins. So just like dipins, medicines will cause hypotension, reflex tachycardia, headache, which is the most common side effect due to the dilatation of cerebral vessels. So due to the dilatation of cerebral vessels, headache is the most common side effect. And nitrates have one big issue, and the biggest issue with nitrate is tolerance. Why nitrates are not drug of choice for maintenance treatment? If you look back at the indication, for maintenance treatment, beta blockers or calcium channel blockers are drug of choice, not nitrates. The reason is this: nitrates are associated with tolerance as a problem, and because of this reason, we avoid giving nitrates for long-term basis. We generally start with other drugs. If patient disease is not controlled, then we put patient on nitrates, otherwise not. That is all about this topic of angina, which we have covered in detail. Now, after angina, we discussed about congestive heart failure. So third topic, congestive heart failure, from where you can expect to have MCQ. So patient of congestive heart failure can come to you in two scenarios. Patient of congestive heart failure can come to you in two scenarios. Patient requires treatment for acute CHF, or patient requires treatment for Patient requires maintenance treatment for CHF. Patient requires treatment for acute CHF, or patient requires maintenance treatment for CHF. Now for acute CHF, which is the first medicine to be given always, the answer is furosemide. So furosemide is considered as drug of choice. It's the best medicine for CHF with pulmonary edema. So this medicine not only reduce your congestion but also reduce your pulmonary edema. So furosemide is the best medicine to reduce congestion and pulmonary edema. If furosemide is not given in MCQ, the other drugs which are useful in acute condition can be morphine and can be nitroglycerin. So morphine and nitroglycerin are two more medicines which we can try in patients of acute CHF. So in patients of acute CHF, we can try morphine and nitroglycerin also after furosemide, right? So furosemide is the best medicine overall, right? Next is, now in patients of acute CHF, ideally only furosemide is able to control the condition. Only furosemide is sufficient enough. But if the patient ejection fraction is very low, if the patient ejection fraction is less than 35 to 40%, in patients of CHF, acute CHF, give only more furosemide, that is sufficient to manage the patient. But sometimes the patient ejection fraction is very low and patient is in cardiogenic shock. So we'll say that the patient has come to you in cardiogenic shock. Then these kind of patients also require inotropic drugs. So the above treatment, you add inotropic drugs. Now, inotropic drugs are those medicines which will increase the patient cardiac output. Now, what are the inotropic drugs that we can use for acute CHF? We have 5 options total. And these 5 options, the best medicine is noradrenaline. So, best inotropic is noradrenaline, ANS. But the second best inotropic for CHF is dobutamine. So, the best inotrope is noradrenaline. The second best is dobutamine. But in this CHF, if there is a presence of oliguria, in patients of CHF, if there is a oliguria, but if the patient is having right heart failure, in patients of CHF, the patient has right heart failure due to the pulmonary artery involvement. So patient is having right heart failure due to pulmonary artery involvement, or there is a pulmonary artery hypertension. So in patients of pulmonary artery hypertension or there is a right heart failure, we prefer to give the third inotropic, that is inodilators. So inodilators are the medicines, the names are Embrinon and Milrinone. The Embrinon and Milrinone are having the word ino in their name. So they are the inotropic drugs. So these medicines are inotropic drugs and they are given for right heart failure. So these medicines are given for right heart failure. The medicines are Embrinon and Milrinone. So Milrinone and Embrinon are inodilators. They are the phosphodiesterase enzyme inhibitors. Drugs are phosphodiesterase enzyme inhibitor given as a inodilators. And in patients of CHF, if there is a arrhythmia, you can also give digoxin for that. So digoxin is a drug which has both properties. It's an inotropic drug plus this medicine is also an anti-arrhythmic drug. So this is the only drug we have which has inotropic plus anti-arrhythmic property. And because of this inotropic and anti-arrhythmic property, this medicine is given to control CHF as well as arrhythmia. So we have 5 inotropics. The best one is noradrenaline. The second is dobutamine. If there is a oliguria, we give dopamine. If there is a right heart failure, we give inodilators like Embrinon and Milrinone. And if there is a arrhythmia, we give digoxin. So this is all about acute CHF. In acute CHF, you should remember 2 groups only. The medicines which can reduce the congestion. One is furosemide. The second is morphine and nitroglycerin. The second is the medicines which can increase the cardiac output. Now coming to the medicines which are given for maintenance treatment. The drugs which are given for maintenance treatment. So the medicines which are given for maintenance treatment, number 1. If we want to maintain the patient of CHF, we cannot maintain on a single drug, right? So CHF patient is maintained on minimum 3 drugs. So we have to give 3 medicines here minimum. And what are the 3 medicines which we use? Number 1 medicine, the drug which can prevent cardiac remodeling. So drugs which can prevent cardiac remodeling will reduce the mortality, improve the survival, and these 5 medicines in a sequence are ARNI. ARNI is the best drug, followed by ACE inhibitor, then ARB, then we have ARA and beta blockers. So 5 medicines which we discussed in a sequence: ARNI plus ACE inhibitor, ARNI followed by ACE inhibitor, then ARB, ARA and beta blocker. Just for the recall, ARNI is a combination of 2 drugs. Angiotensin receptor blocker. So AR is for angiotensin receptor blocker, that is valsartan, and NI stands for neprilysin enzyme inhibitor, that is sacubitril. It's a combination of sacubitril plus valsartan. So this medicine is given to prevent the remodeling. Plus, now apart from a drug that will prevent the remodeling, we will give the second drug that will prevent the tachycardia. And to prevent tachycardia, we give beta blocker. And carvedilol is a beta blocker which is preferred. So carvedilol is a beta blocker that is preferred to prevent the tachycardia. And this is the best beta blocker among all to prevent tachycardia in CHF patient because it has four properties of carvedilol. Third medicine which we will add over here is a drug that is given to reduce the congestion. The drug that is given to reduce the congestion, the drug is furosemide. So three medicines are minimally given. One is to reduce congestion, one is to prevent tachycardia, one is to prevent remodeling. Now fourth medicine is digoxin if required. So it is not always given, it is only be given in cases of severe heart failure. So in cases of severe heart failure, we give digoxin. That is plus minus, like sometimes we require, sometimes we don't require. We start digoxin, when patient gets stabilized, we can stop it also. But again patient deteriorate, we can restart. So digoxin is the drug that is required plus minus in cases of severe heart failure. Now all these medicines we have covered in their respective topics, but digoxin is the drug that we have covered in topic of CHF. So we discussed that digoxin can be written like this way, digoxin. So in this topic of digoxin we have covered that this medicine has DI. Medicine starts with the word DI. So DI stands for 2. So this medicine has 2 mechanism of action. Medicine has 2 indication and this drug has 2 contraindication. So in mechanism of action, medicine will act on cardiac muscles and stimulate cardiac muscle. So this medicine can stimulate cardiac muscle by inhibiting sodium potassium ATPase pump. So by inhibiting sodium potassium ATPase pump, this medicine can stimulate cardiac muscle by inhibiting sodium potassium ATPase pump. Now this medicine can inhibit the cardiac nodes. This medicine can inhibit the cardiac nodes because of its vagomimetic property. So medicine can stimulate the cardiac muscle but inhibit the cardiac nodes. So 2 mechanism of action. Muscles are stimulated by inhibiting sodium potassium ATPase and nodes are inhibited because of stimulation of the vagus center. Now on the basis of this, the medicine has 2 indication. Now because the medicine can stimulate the muscle, this medicine can increase the cardiac output. So this medicine can increase the cardiac output. So I can use this medicine for CHF, and because of its vagomimetic property, this medicine can reduce the heart rate as well as conduction. So medicine is used for the treatment of arrhythmia, that is supraventricular arrhythmia. So medicine has 2 indication, CHF and supraventricular arrhythmia. Medicine has 2 mechanism of action. It is given to inhibit the sodium potassium ATPase pump and increase the cardiac output, inhibit the cardiac nodes having the vagal property, reduce the heart rate. Now medicine has 2 contraindication, and during our lecture we discussed that digoxin is a drug that is obtained from foxglove plant. This medicine we have obtained from foxglove plant. So we made a mnemonic that the fox should not be sent along with hypertrophic wolf. So WPW syndrome is a Wolff-Parkinson's-White syndrome and HOCM is a hypertrophic obstructive cardiomyopathy. That the medicine which we obtained from foxglove plant should not be sent along with hypertrophic wolf. So hypertrophic wolf ke saath you are not supposed to send along with that, otherwise problem will occur. So fox should not be sent along with hypertrophic wolf because the digoxin is a drug obtained from fox plant. That's why this medicine is having the word OX in its name. So 2 contraindication, hypertrophic obstructive cardiomyopathy. The second is Wolff-Parkinson's-White syndrome. Now in this name of digoxin, G stands for its most common side effect and 1 rare side effect. So the most common side effect of this medicine is GIT side effect. So G stands for 1 most common side effect, 1 rare side effect. So the most common side effect is nausea, vomiting and diarrhea, and 1 rare side effect of digoxin is gynecomastia. Now O stands for 1 optic side effect, and the optic side effect of this medicine is this medicine can cause yellow vision as a side effect. So ophtha side effect, optic side effect, yellow vision. Now this cross sign, the X sign is a cross sign and can result in heart block, and this kind of heart block is a variable type of heart block. So digoxin can cause other side effects like bradycardia and variable type of heart block. Now I stands for inotropic effect. So this medicine is an inotropic drug which can stimulate your muscles. And because this medicine can stimulate your muscles, whenever the muscles are overstimulated, whenever these muscles are overstimulated, this medicine can cause arrhythmia that starts from cardiac muscles. So the arrhythmia starts from atrial muscle. This medicine can cause atrial flutter or atrial fibrillation. Arrhythmia starts from ventricular muscles. We call them ventricle type of arrhythmias. So this drug can cause atrial as well as ventricle type of arrhythmia because of overstimulation of the cardiac muscles. They will ask you the most common arrhythmia caused by digoxin. So the most common arrhythmia caused by digoxin is ventricular bigeminy. Now N stands for its toxicity. So this medicine can result in a toxicity. The name of the toxicity is non-PSVT with variable type of heart block. So toxicity of this medicine is known as non-PSVT with variable type of heart block, and the antidote of this medicine is known as Digibind. The antidote of choice for its toxicity is Digibind. So Digibind is a toxicity of this medicine, and from this N you can remember one more side effect. So one of the rare side effect of this medicine is also neuralgia. So N stands for neuralgia. It's a rare side effect of this medicine, and one more side effect is toxicity, that is non-PSVT with variable type of heart block, where we give Digibind. So that is all about the CHF drugs. So digoxin we have discussed in detail here. Rest of the drugs we have discussed in the respective topics. Now after that we discussed our topic of anti-arrhythmic drugs. So the medicines which are given as an anti-arrhythmic drugs. And in anti-arrhythmics we discussed that generation 1 medicines. Generation 1 medicines are sodium channel blockers. We discussed that generation 1 medicines are sodium channel blockers, and these generation 1 medicines can be of two types. Ideally there are three types: 1A, 1B and 1C. We discussed that 1C drugs are not important, so we did not cover in any of the batch. Now generation 1 medicines are quinidine. These medicines are quinidine, and the one more drug is procainamide. So these medicines are quinidine and procainamide. And please remember, this quinidine and procainamide can lead to some common side effect. And what are the side effects of generation 1 class 1A medicines? One is QT prolongation. So these drugs will cause QT prolongation and can result in one arrhythmia. We call it torsades de pointes. So medicines can cause QT prolongation and torsades de pointes. A mnemonic that Q stands for QT prolongation directly. So Q is for QT prolongation, and this pro stands for prolongation. So this will cause prolonged QT interval. So procainamide can cause prolonged QT interval, and quinidine will also cause QT prolongation. These are the class 1A drugs. In class 1B medicine we discussed only one drug, that is lignocaine. So lignocaine is a drug. This medicine is used as a first line drug. We discussed that this medicine is used as a first line drug for ventricular type of arrhythmia. So generation 1 medicines, generation 2 medicines as a beta blocker. Generation 2 medicines are beta blocker. Generation 3 medicines as potassium channel blockers. Generation 3 medicines as potassium channel blocker. The drug that belongs to this class is amiodarone. So amiodarone is a drug that belongs to generation 3 class, right? And this medicine is having the word iodine. So medicine contains the word iodine in its structure, generation 3 medicine, right? Amiodarone is the longest acting medicine available in the market. It's the longest acting drug available in the market with a half-life of approximately 3 months. And this medicine is a broad spectrum anti-arrhythmic drug. This medicine is a broad spectrum anti-arrhythmic drug. This medicine can block multiple pathways. It can block sodium, potassium, calcium channels. Multiple pathways are blocked. And this medicine is given as a drug of choice for atrial fibrillation and atrial flutter. And also this medicine is used as a first line drug for ventricular type of arrhythmia. This medicine is used as a first line drug for ventricular arrhythmia and also given for atrial flutter and atrial fibrillation. And for its side effects are mnemonic, that whenever we give amiodarone, we have to check patient PFT, LFT and TFT. So for amiodarone, we have to check patient PFT, LFT and TFT, and we made the mnemonic that this medicine can cause pulmonary fibrosis. So this drug can cause pulmonary fibrosis. Please make a correction. P stands for pigmentation of skin. So this medicine can cause pigmentation of skin. So P stands for pigmentation of skin, particularly blue pigmentation that is seen in Western country people. C stands for corneal deposit. So this medicine will deposit in cornea like a world-shaped pattern. Because the pattern is world-shaped pattern. So medicine will deposit in a world-shaped pattern, corneal deposits. This medicine will cause pulmonary fibrosis. Drug can cause pulmonary fibrosis. This medicine can also cause liver fibrosis. Drug can cause liver fibrosis, and TFT mein this medicine can cause hyper as well as hypothyroidism as a side effect. So medicine can cause hyper as well as hypothyroidism as a side effect. Class 3 medicine. 4 medicines. Class 4 medicines are calcium channel blocker, and the Verapamil is a drug that we have covered already. So Verapamil is a medicine that is class 4 medicine. Some 5 medicine, and there the adenosine was the most important drug. That adenosine is a drug. It's a shortest acting medicine. This drug is shortest acting drug because it is rapidly metabolized by RBC. It is a shortest acting drug because it is rapidly metabolized by RBC. So whenever we have to give this medicine, we always have to give this medicine by IV bolus. This medicine always by IV bolus followed by saline push. So we have to give medicine by IV route. Bolus dose, the single dose is given in a, like rapidly we give the dose in a one go, followed by we have to give a saline push. And the first dose of this medicine is 6 milligram, and the second dose of this medicine is 12 milligram. The first dose of the medicine is 6 milligram. The second dose of the medicine is 12 milligram. And this medicine, the important side effect is bronchospasm. The important side effect of the medicine is bronchospasm. So this drug should not be given to a patient of bronchial asthma and COPD. So in patients of bronchial asthma and COPD, this adenosine should not be used, anti-arrhythmic drug. So that is all about this topic, CVS. Now we have the second topic, the medicines which are given for GERD. Now please remember, for the treatment of GERD, we give 2 medicines in combination. We always give 2 medicines in combination. One is given to suppress the acid production and the other is given to reduce the food storage. So 2 medicines given in combination. One is given to suppress the acid production. The other is given to reduce the storage of food in GIT. So if there is no food stored in the GIT, there is no reflux of the food back to the esophagus. Right? So the medicines which can suppress the acid, now best is PPI, proton pump inhibitor. The second best is H2 receptor antagonist, and we discussed already, among H2 receptor antagonists, nowadays we use famotidine only. Ranitidine is getting outdated because of cancer. Cimetidine is already outdated due to gynecomastia. Now the second class of drugs which can reduce the food storage in GIT, these medicines are given to increase the peristalsis. So these drugs will increase your peristalsis, and because the medicines will increase your peristalsis, we call them prokinetic drugs. So drugs will increase the peristalsis, we call them prokinetic drugs. There are 3 classes over here. Number 1, the drug which will directly act on 5-HT4 receptor, serotonin 4 receptor. So serotonin 4 receptor is present in your intestine wall, and if you stimulate this serotonin 4 receptor, 5-HT4 receptor, peristalsis is directly increased. So nerves of your GIT will be stimulated. When the nerves of your GIT will be stimulated, this will increase the peristalsis. Now all these medicines ending up with the word pride. All these drugs will ending up with the word pride, like Cisapride, Mozapride and Itopride. So drug names are Cisapride, Mozapride and Itopride. Now Cisapride is a drug which is outdated. Now why this drug is outdated? Because of QT prolongation and torsades de pointis as a side effect. Now we have drugs which are blocker of dopamine pathway. Now these medicines which are dopamine pathway blocker, whenever we block the dopamine pathway, then automatically acetylcholine level will increase in GIT, and this acetylcholine which is increased in GIT, this will increase the peristalsis. So this will increase the peristalsis which is due to increased acetylcholine by blocking the dopamine pathway in GIT. 2 medicines, domperidone and metoclopramide. Now these medicines when given to a patient, medicines also have anti-emetic property. So these medicines not only reduce the food storage but also having the anti-emetic property, so give you better relief, give you symptomatic relief in vomiting also. Plus we have one antibiotic which will directly stimulate the motilin receptor. The medicine that will directly stimulate the motilin receptor in your GIT and increase the motility, the drug is erythromycin. So just for your MCQ, erythromycin is given for GERD. Next topic is the medicines which are useful for nausea vomiting. So the drugs which are given for nausea vomiting, we call them anti-emetic drugs. So we have four types of vomiting. Number one is chemotherapy induced vomiting. CINV stands for chemotherapy induced vomiting. Number two is the vomiting due to motion sickness. Number three, the vomiting due to morning sickness, that is in pregnant female. And if there is any other type of vomiting apart from these three. Let's start with the first, the medicines which are given for chemotherapy induced vomiting. Now chemotherapy induced vomiting we can divide in two classes. Now this vomiting can have early onset, can have delayed onset. Now early onset means the vomiting will start within 24 hours of drug intake, and delayed onset means the vomiting will start after 24 hours of drug intake. So if the vomiting will start within 24 hours of onset, we have to give 5-HT3 blocker or serotonin 3 blocker. So medicines which are drug of choice are known as 5-HT3 blocker or serotonin 3 receptor blocker. One example is palinosetron. Other examples are like granisetron and ondansetron. So 5-HT3 blocker are palinosetron, granisetron and ondansetron. And what are the side effects of these medicines? These medicines like ondansetron can cause headache. So the most common side effect of ondansetron is headache. Other side effect is like constipation. So two important side effects of this medicine. One is known as headache. The most common side effect is headache. The second side effect is constipation of this ondansetron. Best medicine for early onset chemotherapy induced vomiting. Now we have delayed onset vomiting. For delayed onset vomiting, we prefer to use substance P inhibitor. So the medicines are substance P inhibitor which we prefer, and the drug is aprepitant. The mnemonic ANT stands for antagonist of pit. So whenever you have to vomit out, you require a pit, and in that pit you will vomit out. So this medicine will antagonize. This medicine will antagonize your movement towards the pit. So when at the time of vomiting, you have to go to the pit. So when you antagonize this pit, then there is no need to do the vomiting. So medicines are substance P inhibitor. Substance P में we made a mnemonic. Substance P stands for pukish substance, right? So substance P is pukish substance. P is for pukish. Pukish means vomiting. So it's a substance which can cause vomiting, pukish substance. And aprepitant is a drug that is antagonize the pit, and now you need not to go to the pit and have the vomiting. Now the motion sickness that we have already covered, hyoscine is the drug of choice. So hyoscine is the drug of choice which is given in the form of skin patch also. But in India, we mostly use promethazine. So in India, we mostly use promethazine as a best medicine for motion sickness. Morning sickness, we always give this combination, doxylamine plus vitamin B6 combination. So doxylamine plus vitamin B6 combination is the best combination for the treatment of morning sickness. Now for any other type of vomiting, we have discussed that we can give dopamine blockers. So dopamine blockers we have discussed here also, if you remember. So here these dopamine blockers which are given to increase the peristalsis, also given for their anti-emetic property. The drugs are domperidone and metoclopramide. Now out of these two, we discussed that the metoclopramide is a drug which can cross blood-brain barrier. So metoclopramide is a drug which can cross blood-brain barrier, and by crossing the blood-brain barrier, this medicine blocks the dopamine receptor in CNS and can result in two very serious problems. One is extra pyramidal symptom. Second is hyperprolactinemia. So drug can cause extra pyramidal symptom or body movement disorder. So patient will have problems of body movement. So patient will develop body movement disorder, and medicine will cause hyperprolactinemia as a side effect, right? But domperidone is a drug which will not cross blood-brain barrier. Now this medicine will not cross blood-brain barrier. So this medicine will not cause this side effect. So this side effect is not seen with domperidone but seen with metoclopramide, and because of this reason this medicine is unsafe in children, because in children blood-brain barrier is weak, and because the blood-brain barrier is weak, this medicine metoclopramide should not be given to children. That is all about this vomiting. We have discussed 4 types of vomiting: chemotherapy induced vomiting. For early vomiting we give 5-HT3 blocker. For delayed vomiting we give substance P inhibitor like aprepitant. For motion sickness we give hyoscine and promethazine. For morning sickness we give doxylamine plus vitamin B6, and for other type of vomiting we give domperidone and metoclopramide. Now the last topic in GIT was diarrhea. Now diarrhea can be of 2 types: non-infective and infective. Now for non-infective diarrhea we give loperamide as the drug of choice, which is an opioid, and second drug of choice atropine. Now for infective type of diarrhea you have to give medicine according to the type of diarrhea. For example, if you have to just give the empirical therapy, empirical means without knowing the bacteria. So without knowing the bacteria, if you want to give some antibiotics, so always give fluoroquinolones. So fluoroquinolones are the best medicines to be given over here. But if the patient is having cholera, give doxycycline. So doxycycline is the best medicine for cholera. For dysentery, that is due to Shigella, when the patient is having blood in the stool, we give ciprofloxacin. So ciprofloxacin is given for dysentery. For amoebiasis, when the patient is having amoebiasis, give metronidazole as the best medicine. And for Campylobacter jejuni bacteria, if it is given to you in MCQ, patient is having Campylobacter jejuni bacteria, give azithromycin as a best medicine, right? So these are the drugs which we use for GIT. This topic is over. Now next topic is endocrine. And from this topic of endocrine, that 4 MCQs will be asked from this topic, right? Now one question can be asked from diabetes mellitus. One question will be asked from SERM, that is selective estrogen receptor modulator. So one question will come from diabetes, one question will come from SERM topic, selective estrogen receptor modulator, and one question will come from your thyroid. So medicines which are given for hyperthyroidism, and plus minus one question can be asked from osteoporosis, the drugs which are given for osteoporosis. So these are the 4 topics which are important for your exam. So you can write down like this way: 3 to 4 MCQs will be asked, minimum 3, maximum 4 MCQs from this topic of endocrine. So first topic is diabetes, the drugs which are given for diabetes in topic of endocrine. So the medicines which are given for diabetes mellitus. So there are 4 groups of medicines total. There are 4 groups of medicines which we use for diabetes. One is insulin. Insulin we can use for diabetes, the first group of medicine. The second is the medicines. So for the treatment of diabetes we can use insulin as one of the drug. Number 2, we can give the medicines which can stimulate the beta cells. So the treatment of diabetes we can give the medicine which can stimulate the beta cells and can increase the secretion of insulin. Number 3, we can give the medicines which can reduce the insulin resistance. The drugs which can reduce the insulin resistance we can use. And the 4th, the medicines which can increase glucose elimination from the body. So 4 group of medicines we can use. One is insulin for the treatment of diabetes. Number 2, we can use the medicines which can stimulate the beta cells of pancreas and can result in increased insulin secretion. Number 3, we can use the medicine which can reduce the insulin resistance. And number 4, the medicines which can increase glucose elimination. Now if we talk about insulins, we have 4 types of insulins nowadays available. One is rapid acting, second is short acting, third is intermediate acting, and the 4th is long acting. So rapid acting, short acting, intermediate acting, and long acting insulin are 4 types of insulin. So we have 4 types of insulin. One is rapid acting, short acting, intermediate acting, and long acting insulin are 4 types of insulins which are available in the market. Now what are the names of rapid acting insulin? The names of rapid acting insulins are insulin glulisine. So the mnemonic was GAL GUL. So insulins are insulin glulisine. So insulin glulisine is there, insulin aspart is there, and insulin lispro is there. So we have 3 insulins which are known as rapid acting insulin. One is insulin glulisine, insulin aspart, and insulin lispro. Now we have short acting insulin. One is insulin regular and the second is known as insulin semi-lente. So insulin regular and insulin semi-lente are two insulins which are short acting insulin. Now insulin regular can be given by IV route and it's a drug of choice. This insulin is a drug of choice for diabetic ketoacidosis. This is the drug of choice for diabetic ketoacidosis. Now insulin semi-lente. Insulin semi-lente is also known as zinc amorphous insulin. This is also known as zinc amorphous insulin. So insulin regular given by IV route, it's a drug of choice for DKA, and semi-lente insulin is also known as zinc amorphous insulin. Now we have intermediate acting insulin. Intermediate acting insulins are insulin NPH, which is also known as insulin isophane, and we have insulin lente, which is mixture of 30% semi-lente and 70% ultra-lente. Insulin lente is a mixture of 30% semi-lente and 70% ultra-lente. The last is long-acting insulin. DD is Ultragal. Four medicines over here. One is insulin ditamer, one is insulin D-glutec. So insulin ditamer, insulin D-glutec. The third one is insulin ultralente, and one more is insulin glargine. So there are four insulins which are long-acting insulin: insulin ditamer, insulin D-glutec, insulin ultralente, and insulin glargine. So these are the four types of insulins we have. Rapid acting insulin, mnemonic is GAL, that is GAL. So G stands for glulisine, A stands for aspart, L is for lispro. Short acting insulins are regular insulin and semi-lente. Intermediate acting insulins are lente and NPH. And long acting insulins are ultralente, ditamer, D-glutec, and glargine. Now out of these insulins, please remember the insulin D-glutec. Insulin D-glutec is the longest acting insulin. Insulin D-glutec is the longest acting insulin, and insulin glargine is also known as peakless insulin. Insulin glargine is also known as peakless insulin, and it cannot be mixed with any other insulin. Insulin glargine cannot be mixed with any other insulins. So this is all about the first class of drug, that is insulins, right? Next is we have beta cell stimulator. The drugs which are stimulator of beta cells, we call them secretagogues, because these medicines stimulate the beta cell and can result in insulin secretion. Now the drugs are sulfonylureas. Now sulfonylureas are the drugs when given to a patient. These medicines name starts with what? GLI. Examples are like glipizide, glimepiride, gliclazide, all these medicines are there. And the second group is meglinides. Now please remember, meglinides are the drugs which are having the word glinides. Examples are repaglinide and natiglinide. Now whenever these medicines are given, these medicines can cause hypoglycemia as a side effect. These medicines can cause hypoglycemia and weight gain as a side effect. So these medicines can cause hypoglycemia as a weight gain as a side effect. So sulfonylurea are those drugs which are having the word GLI. And meglinides are the drugs which are having the word glinide in their name. So meglinides examples are repaglinide, natiglinide. Sulfonylurea names are glipizide, glimepiride, all these drugs. Side effects are hypoglycemia and weight gain. Now we have the drugs which are known as GLP-1 analogs. Now all these medicines are having the word glutide in their name. So from this glutide you can remember these are the glucagon-like peptides. So G stands for glucagon-like peptides. So they are the GLP-1 analogs. We call them glucagon-like peptide analog. One example is like liraglutide, semaglutide. Now these drugs will not cause hypoglycemia. So there are two properties of drugs. These medicines will not cause hypoglycemia as caused by above two groups. So if you look at the above two groups, other two groups will cause hypoglycemia. They will not cause hypoglycemia. Above two groups will cause weight gain. These medicines will cause weight loss. So these are the two advantages of these medicines. So what are the two advantages of these medicines? These medicines will not cause hypoglycemia, and these medicines, instead of causing weight gain, will cause weight loss. Right? Now we have DPP-4 inhibitors. The medicines which are DPP-4 inhibitors, these medicines are known as gliptins. like sitagliptin, vildagliptin, linagliptin. Now these medicines are weight neutral. These medicines are weight neutral, and also these medicines rarely causes hypoglycemia. So hypoglycemia is again not very common with these medicine. So hypoglycemia is rare, and these medicines are weight neutral. They will not increase the weight, they will not decrease the weight. So these are the four group of medicines which are known as secretagogue. Sulfonylurea medicines are having the word GLI, like glipizide, glimepiride. Meglinitide is having the word glinide, that is repaglinide, naticlinide. GLP-1 analog, the drug is glutide, like glucagon like peptide, liraglutide and semaglutide. DPP-4 inhibitors are the medicines which are having the word gliptin. Among all gliptins, there is one gliptin which is safe to use in patients of CKD. Linagliptin is a drug which is purely metabolized by liver. So linagliptin starts with Li. That linagliptin starts with Li. So this drug is metabolized by liver. So this is the only gliptin which is safe to use in patients of CKD. This is the only gliptin which is safe to use in patients of CKD. And regarding GLP-1 analog, this is the group of medicines which is given by subcutaneous route. GLP-1 analogs are given by subcutaneous route, but there is one drug over here. The drug name is semaglutide. Semaglutide is a medicine that can be given by oral route also. So semaglutide is the only drug in GLP-1 analog which can be given by oral route. Two MCQs on these drugs. One is regarding gliptins. So gliptins mein the MCQ is linagliptin starts with Li, purely metabolized by liver and safe to use in patients of CKD. And regarding this glutides, semaglutide is a drug which is also given by oral route. So all medicines given by subcutaneous route, but semaglutide is the only drug which can be given by oral route here, right? Now we have a third group of medicines which can reduce insulin resistance. Medicines which can reduce insulin resistance. So two drugs are here, metformin and pioglitazone. And please remember, metformin is considered as drug of choice for diabetes mellitus 2, and pioglitazone is a drug which will act on PPAR gamma receptor. So if you remember, in angiotensin receptor blocker, telmisartan, that also act on the same receptor. So pioglitazone is a drug. This medicine will act on PPAR gamma receptor, but this medicine can increase the risk of bladder cancer as well as CHF. This medicine can increase the risk of bladder cancer and CHF. That's why this drug is getting outdated. So pioglitazone is a drug which can reduce insulin resistance. If you reduce insulin resistance, then glucose uptake will take place in periphery. Medicines can cause increased glucose uptake in the periphery. So pioglitazone, which will act on PPAR gamma receptor, the drug is getting outdated because of the risk of bladder cancer and CHF. And metformin is a drug when given to a patient. This medicine can lead to two important side effects. So this medicine can result in vitamin B12 deficiency, and this medicine can also cause lactic acidosis. So two important side effects of metformin are vitamin B12 deficiency can result in megaloblastic anemia and can also result in lactic acidosis as a side effect. So this is about the drugs which can reduce insulin resistance. Now we have a drugs which can increase the glucose elimination. So medicines are SGLT2 inhibitors. Now SGLT2 inhibitors are the drugs which are inhibitor of sodium glucose transporter 2. Medicines inhibit sodium glucose transporter 2. So these medicines can result in loss of sodium as well as glucose. So these drugs can result in loss of sodium, glucose as well as water. So along with sodium and glucose, water is also lost from the body. So these drugs can cause loss of sodium, loss of glucose as well as loss of water. And because these medicines can cause loss of sodium, glucose and water from the body, there is a drug known as dapagliflozin. So dapagliflozin is a medicine. This medicine is approved for the treatment of CHF. So dapagliflozin is a drug that is approved for the treatment of CHF because the medicine can reduce the congestion in the heart. Plus, medicines can reduce the glucose level. Medicines can control diabetes also. So by reducing sodium and water, medicine can reduce the congestion given for CHF. And by reducing the glucose, these drugs are also given for diabetes. But there is a problem that whenever you give the medicines will cause continuous presence of glucose in the urine. So there is an increased risk of UTI. So with the use of these drugs, there is an increased risk of UTI along with these medicines. Now we have some drugs which are inhibitor of glucose absorption in small intestine. So medicines are inhibitor of glucose absorption in small intestine. We call them alpha glucosidase inhibitors. So medicines are known as alpha glucosidase inhibitors. So these medicines are having the word bose in their name. For example, icarbose and voglibose. And whenever you give these medicines can cause flatulence as a side effect. So drugs will cause flatulence as a side effect, right? So we have total 4 groups of anti-diabetics. One is the types of insulin. So first is insulin. 4 types of insulin we have covered: rapid acting, short acting, intermediate acting, and long acting. And the second group is medicines which are stimulator of beta cell. Again, 4 type of medicines are there, like sulfonylurea, meglinitydes, GLP-1 analogs, and DPP-4 inhibitors. Third is medicines which can reduce insulin resistance and increase the glucose uptake. The drugs are metformin and pioglitazone. So metformin is drug of choice for diabetes mellitus 2, can result in vitamin B12 deficiency and lactic acidosis. And pioglitazone is a drug which will act on PPAR gamma receptor. Drug is getting outdated because of the risk of bladder cancer and CHF. The drug which can increase glucose elimination, the drugs will act on kidney. So these medicines will act on kidney, and by acting on kidney, medicines will inhibit sodium glucose linked transporter 2 and can result in loss of sodium, glucose as well as water. So dapagliflozin is given for the treatment of CHF, and alpha glucosidase inhibitors will act on small intestine, can result in loss of glucose. The medicine is icarbose and voglibose. The side effect is flatulence. So which can be asked in this year. So which is the longest acting insulin? If this question is asked, which is the longest acting insulin, the answer is D-glutec insulin. Which is a peakless insulin? That's insulin glargine. Now, which anti-diabetics cannot be given by oral route? So which anti-diabetics cannot be given by oral route? One is insulin, one is GLP-1 analogs. So GLP-1 analogs and insulin cannot be given by oral route. They are given by subcutaneous route, but there is one exception, that the drug name is semaglutide. Now semaglutide is a drug which is given by oral route, which can be given by oral route also here. So there is one GLP-1 analog, the drug name is semaglutide. So semaglutide is a drug which can be given by oral route. Rest of the medicines are given only by subcutaneous route. Now one of the important side effects of GLP-1 analog is hemorrhagic pancreatitis, vitamin B12 deficiency and lactic acidosis. Vitamin B12 deficiency and lactic acidosis are 2 important side effects of metformin. Now bladder cancer risk is increased with pioglitazone, and the gliflozin medicines like dapagliflozin and all can increase the risk of UTI, and the medicines like icarbose and voglibose, which are alpha glucosidase inhibitor, these medicines can cause flatulence, so should not be given to a patient of inflammatory bowel disease. And if I ask you this question, which gliflozin is approved for the treatment of CHF? So for the treatment of CHF, dapagliflozin. Dapagliflozin is a medicine that is approved for the treatment of CHF. Dapagliflozin is a medicine that is approved for the treatment of CHF, right? And one more question, which medicine is safe to use in patients of CKD? So the drug which is safe to use in patients of CKD, the drug name is linagliptin. So linagliptin is a medicine which is safe to use in patient of CKD. There is one GLP-1 analog which is given by oral route also. The drug name is semaglutide. That is all about this topic, diabetes mellitus. Next is the drugs which are given for osteoporosis. Now the osteoporosis is due to the calcium deficiency in bones. Osteoporosis is due to the calcium deficiency in bones. So patient will have calcium deficiency in bones. We call it osteoporosis. The condition is known as osteoporosis. Now whenever we have to treat osteoporosis, we have 3 approaches. The first approach, we can provide calcium to the bones. So we have medicines which will provide calcium to the bones. The second approach is to increase the activity of osteoblast. So the drugs which can increase the activity of osteoblast is a second approach. So the medicines which can increase osteoblast activity are known as anabolic drugs. The third approach is to inhibit the osteoclast. So how we treat osteoporosis? There are 3 approaches. One is to provide calcium to the bones. Second approach is to increase the osteoblast activity, and the third approach is to inhibit the osteoclast activity. right? So let's start with the first, the medicines which will provide calcium to the bones. So medicines are calcium itself. So calcium itself is used as a drug in the form of tablets. Number two, vitamin D also. Vitamin D can also help in moving the calcium towards the bone. Third is calcitonin. So calcitonin is a third hormone which is given in the form of nasal spray. So three medicines which will provide calcium to the bones. One is calcium itself, second is vitamin D, and third is calcitonin hormone. Now we have the drug which is stimulator of osteoblast. Now this is very important for your exam. The only drug which can stimulate the osteoblast activity in your bones, that is known as anabolic drug. This is teriparatide. Now teriparatide is a drug which is given by subcutaneous route, and this is parathyroid hormone analog, which you can remember from this word para. So medicines are given for parathyroid hormone analog given by subcutaneous route. It's a parathyroid hormone analog given by subcutaneous route. It's a stimulator of osteoblast. The last is the medicines which are inhibitor of osteoclast. Now the drug which is inhibitor of osteoclast, we call them anti-resorption drugs. So if we inhibit osteoclast, then automatically osteoblast activity will be more. Now medicines are bisphosphonates. So bisphosphonates are the drugs which are considered as drug of choice for osteoporosis. So bisphosphonates are the drugs which are considered as drug of choice for osteoporosis, and these medicines are having the word dronate in their name. So these medicines are having the word dronate in their name. So bisphosphonates like alendronate, ibendronate, these drugs are there. We have one monoclonal antibody. So MAB stands for monoclonal antibody. So monoclonal antibody is denosumab. So denosumab is a drug which is having the word OS. So this medicine is given for osteoporosis. It's a osteoporosis monoclonal antibody inhibitor of osteoclast. Plus we can also use estrogen. So estrogen is used as a drug in a hormone replacement therapy. So as a hormone replacement therapy, we can use estrogen as a drug. One is estrogen receptor modulator. There is a drug which is estrogen receptor modulator. The drug is raloxifene. So raloxifene is a drug which is estrogen receptor modulator. The drug is raloxifene. So we can also use this medicine as SCRM, also for osteoporosis. Now we have one heavy metal which we use as a drug, that is strontium. I hope you know the periodic table from your school days. If you know the periodic table from your school days, calcium, magnesium and strontium, they all come in a same line. So strontium, magnesium and calcium, body cannot differentiate. So if you give strontium, strontium takes entry in the bones and inhibit the activity of osteoclast, right? So strontium, calcium and magnesium, body cannot differentiate. So strontium takes entry in bones and can inhibit the activity of osteoclast.